Hey, Dr. Shakib here from Core Pelvic Floor Therapy in Irvine. Just wanted to share with you some of the things that makes this office very, very different from most places that treat pelvic floor dysfunction. Now, your complaint may be chronic back pain, it could be chronic sacroiliac pain, it could be tension across the lower part of your back, it could be really weak posture, lower ab issues, it could be a forward tilt or backward tilt. It could be in forms of incontinence, sexual dysfunction, pubic symphysis pain in the pelvic region itself. It could be chronic hip issues. Whatever it is, it gets all packaged under the umbrella of pelvic floor dysfunction. So my specialty is postural neurology, functional movement, and I incorporate that in my addressing pelvic floor dysfunction. So while sometimes there are things that are contraindicated, for example, if you have the kind of incontinence that is just the spasm of the muscles on the inside, there are certain things we do that are actually not necessary. In fact, they can mess it up. So when you come in, I'm going to examine you to see exactly what your cause is. If it's neurological, to some degree, depending on what the presentation is, we could help it. Sometimes it may be other things like multiple sclerosis. Well, nothing we do is going to help it other than working towards improving your posture, which is not going to make your multiple sclerosis go away, but it's going to help you with slowing down the postural decline that contributes to it. So bottom line here is that in my office, we don't just go manually inside to work on the pelvic floor muscles. We go all the way addressing the orthopedic part, neurological part, postural part, musculoskeletal part, including the inside of your pelvis. In this office, we also have a machine called emsella, which is actually FDA approved for incontinence. However, the way it works is it works on the strengthening of the pelvic floor muscles by doing 400 kegels a minute. So that's, we don't mess around. If it is indicated, we go in and we address it full force. I know how it feels to be limited by things you seem to not have a control over. I know that it doesn't make fun to live the way with these limitations. So I'm here with my team to go in, find out exactly what's going on, tell you exactly how we're going to approach it, and then go for it. If you have any questions, just contact one of the sources of contact in the description box, and we're right there for you. Take care.